Hello and namaste viewers. I am Sanjeev Pandya welcoming you to Ayurveda Mantra Show by Santigram Kerala Ayurveda Wellness Center USA. The show is all about Ayurveda benefits and happy and healthy life with longevity. And to explain more and to make us understand more on Ayurveda benefits, we are joined by Dr. Ambika Nair of Santigram Kerala Ayurveda Wellness Center USA. Ambika ji, show में फिर से आपका स्वागत है.
Hello Sanjeev ji, how are you? Namaskar.
Namaskar
To everybody.
Ji.
Thanks a lot for watching my show.
After learning so much from you about Ayurveda and benefits of Ayurveda and what Ayurveda is all about and how important Ayurveda is, and most importantly how Ayurveda can cure without any side effects. So we thank you for that. And then as we begin our show, Ambika ji, today's topic is something which I like to say it's if it's not common, it's out there. Many people are suffering from this.
Okay.
It is it is affecting their daily lives and it's upsetting their daily lives, and they perhaps are clueless on this matter, how to take care of that. And this is something that you can't even share this with your friends or somebody that you're having this. You can only share with your doctor, and you keep it to yourself. But one of our viewers contacted us and asked us to give more information on IBS, known as irritable bowel syndrome.
You are surprising every time.
Thank you.
Anyway, that's a very nice topic you have chosen
Thank
today.
you. Yes, and that credit
it's
goes
very
to our
informative
viewers.
also because so many people suffer. Like that really affect their life a lot. Yeah.
It's a long-term gastrointestinal disorder, right?
Like how they say is that let's see, like husband and wife is going to go out. One of them, normally a husband will tell, okay, just I am coming. So he feels the urge to go to the bathroom. Okay, the restroom, especially for the bowel movements. And even after passing, you feel like going again.
Correct.
And it's very disgusting. Yeah, that's there.
Question is, why is it happening? And what causes it? So what is IBS all about? And let's just talk about what causes it.
IBS means it is irritating bowel syndrome. Only your bowel you feel, like especially after eating little bit. You feel that heaviness, little bit heaviness in the stomach, and the urge will come for you to go to the restroom. Okay, that is there. Not only that, because like in the long run you can see how these people lose their weight. They become very fatigued because they are not getting any nutrients. You understand? Now, whatever you are eating, it is just going away. Because actually it is a disorder. IBS is strictly it is a disorder of the small intestine. Because
it's a small intestine,
it
not
is
the
small
big
intestine,
one.
not the large intestine. Okay, it is actually because see all our absorption, digestion, everything has to be it happens in the small intestine. Like that's one of the things. Okay, and the causes are like endless causes are there. Okay, see like pitta person. See, it all depends upon how, whether it is pitta, kapha or vata. Okay, if it is a pitta person means like they will have a lot of mucus and even blood can come, like ulcerative colitis, IBS turns out to be colitis later. Okay, so like you can see that how many times, 6 to 7 times, sometimes 13 to 14 times, some people go like 30 times. Yeah, they come like that. So their daily routine life is, like in the office also they cannot sit. If somebody asks you something, that you have that pressure, that is means that is with the stress. So you feel like rushing to the loo.
Okay.
Yeah.
So IBS leads to colitis, or if
IBS
you have a
leads
colitis,
to, anxiety leads to the cause, the root cause is anxiety.
Correct.
like acid reflux. Okay, that is the hyperacidity, understand? Then which will turn into IBS,
Correct.
irritating bowel syndrome.
Yes.
Okay, then which will lead to ulcerative colitis.
Wow.
Okay, so sometimes there won't be bleeding, but sometimes it will bleed also. Then it will be like with the bleeding, and the causes are so many are there. First of all, stress is there,
Correct.
anxiety is there, then so much of anger, unnecessarily you get angry. Just for nothing, impatient. I should say impatient.
Correct.
No patience in their life for anything. If like 10 o'clock we have to reach, means from 8 o'clock they will be ready. So, like they want to rush. Like maybe like 5 minutes only, but still they rush a lot.
Correct. Yes.
And make others' life also miserable.
What you are saying, Ambikaji, obviously these are very concerning issues that you're mentioning.
Very concerning.
And no wonder that IBS can become so difficult and so uncomfortable for a person to deal with it, right?
Yeah, sometimes it relates to Crohn's also, because very major disasters happen.
And then what you mentioned is that loss of blood.
Yeah.
That could be very, very damaging to
that
body.
will be very difficult later to manage also, because actually if it is a kapha person, sometimes it is not a must that they will always go with diarrhea. There won't be diarrhea for so many people. It will be just like either with a constipated stool, but urge is there. You got it? Okay. If kapha means they feel that they have not evacuated properly.
Correct.
So that urge will be there. But it may be a well-formed stool also sometimes. Otherwise, it will be a diarrhea or a constipation. It can alter both. Okay. So it shows that their digestion is not proper. That see, everything in Ayurveda we call, if your acne is good.
Yes.
Okay. If your acne is good, you need not to worry for anything.
Oh, absolutely, absolutely. There's no doubt about it. If your stomach is healthy, then you
are
at
80%
least 80% healthy. I was going to say 70%, but you are 80% healthy, because that is the key thing. If your stomach is not healthy, and if you're experiencing this IBS syndrome that you just talked about, right, then definitely that ruins your day, and that really makes it very difficult for you to live day by day.
Like depression, very severe depression they get into.
Okay. Now, on that thought, why they are having this, and to make them understand, we're going to talk about that in the next segment. You're watching Ayurveda Mantra Show by Santigram Kerala Ayurveda Wellness Center, USA. We'll be right back after this messages. Please don't go anywhere. Welcome back to the Ayurveda Mantra Show by Santigram Kerala Ayurveda Wellness Center, USA. While we thank you viewers for watching this show, and thank you for your comments and the suggestions, and I also like to encourage and advise you that if you have any question about your health and Ayurveda, please send us an email, info@santigramusa.com. In the first segment, we started to talk about IBS. IBS happens to be our topic of the day, irritable bowel syndrome. Roughly, they say about 25 to 45 million Americans are affected by IBS. And here, Dr. Ambika Nair of Santigram Kerala Ayurveda Wellness Center is educating us and letting us know the causes of it and how it can be cured through Ayurveda. So that's what we are finding out. IBS, irritable bowel syndrome, that you mentioned, right? And at a young age, you have seen it at a young age. But is it more common in male or female?
Male I have seen more, but in female also I have seen.
Achha.
Lot of IBS. Now, especially in the new generation, these girls also, so many IBS are there.
Now, you can't blame everybody for the eating habits. It's not that everybody is not following diet or something. No. So that is not the cause. That is not the main cause. That could be maybe one of it, a little bit, but that's not the main reason.
See, when you go for, like endoscopy or anything, there won't be any structural, changes in the body.
Correct.
Okay, only problem is that, that they start thinning down. Some people, then, like in allopathy, they will give them antibiotics, then steroids, and there are so many other things what they give, some nutrients and everything. Okay, sometimes it will work, then again, the moment they stop it, again it comes back to them.
Achha.
Okay. And the causes can be even hereditary factors also.
That's what I was going to ask you.
Hereditary factors also sometimes, because
Okay.
the parents were not taken care in the proper way, or malnutrition, or did not bother for all those things. Sometimes it can happen like that.
All right.
Okay.
So this IBS,
Yeah.
irritable bowel syndrome, and also part of colitis and the
Yeah.
Crohn's disease.
Like, if any inflammation, not only hereditary, sometimes it can be because of the, inflammation of the small intestine. Okay. Any chronic diseases. Okay. I had a very aged guy who came to me like 68, no, like 78.
Okay.
So he was very healthy. He was the priest. So he came and told me that, can you do? Then we gave, but we know that where to, because he was unable, very feeble he became. He was unable even to walk.
Wow.
But I helped him a lot. Okay. I cannot say that I cured him because he had all other, issues. So it gets into the whole system.
Yes,
actually,
absolutely.
it gets into the whole system. That is one of the, very bad thing.
That I think, Dr. Nair, that we should tell our viewers is that, God forbid, if you or anyone in your family, if they are experiencing any of this syndrome, then please don't ignore it, don't delay it, go to see your doctor as soon as possible.
Very nice.
Yes,
Very
absolutely.
nice tips.
Because a lot of people actually, they say, well, maybe I ate something. For example, in our community, South Asian community, people tend to eat more spicy food. So they may think, well, I had a spicy food night before, I went to this restaurant, I went here, I went there, and maybe that's what it is. But that may not be the cause, right?
That can happen 1 or 2 times. You understand?
Correct.
No, not
Yes.
that every day you go like that.
Absolutely.
See, and the parents always should see that, especially it is seen mostly in the teenagers also nowadays. Okay, the parents should always see that how often these children go, that is more important actually. Because we just ignore,
Yeah.
कोई बात नहीं,
Ignorance
वो तो bathroom में बैठा
वो bathroom, हाँ, वो हो
है.
जाएगा.
It is not like that actually.
And then when you say that if, a patient with IBS,
Yeah.
they have to go to bathroom anywhere from 10, 20, 30 times
So
a
many
day.
times.
That means basically no matter what you eat or drink little, you have to rush to the
So
bathroom.
nothing get absorbed, you see, because the small intestine with the vata, it has to push. See, like all the, unwanted things only will get into the large intestine.
That is with the good vata.
Yeah,
That
so that is with the good vata,
Right.
Apanga vata, so we call it as, okay, so, it has to be pushed. But here it has been, a small intestine became inactive. So it is no action, especially the rugae, there is a lining in the stomach. That is called, intestinal rugae. This is like a sea waves.
Right.
How we to bring it down with the gravity. Okay, so that's why with the gravity our food comes down. Here you don't eat in time.
Yes.
And so much of acidity is formed.
Correct.
All the rugae got, out.
That will go.
Okay. So like a block, it comes down.
Correct. Yes.
So that's one of the reasons I have seen that. So, and some people, especially people from Andhra Pradesh, you ask them to stop the spices
Spicy food.
little bit, my goodness, they get so angry and they will tell you, no, we will not stop it. And it is very difficult to tackle sometime,
Could excessive amount of spicy food lead to this?
Not only spicy food, the causes comes, see, if you fasting without anything, like 1 day fasting, Tuesday fasting, Thursday, maybe only Wednesday they don't fast. Okay, so if you eat, like a fast too much also, this become like
Fasting
this
is also
IBS.
not good.
Okay.
All right, with that note, let's just hold on to it. We're going to come back with more information on IBS, irritable bowel syndrome, our topic of the day. And you're watching Ayurveda Mantra Show by Santigram Kerala Ayurveda Wellness Center, USA. Please don't go anywhere. Welcome back to the third segment of Ayurveda Mantra Show by Santigram Kerala Ayurveda Wellness Center, USA. In this show, viewers, we educate you and we inform you about Ayurveda and the benefits of Ayurveda. We are so thankful to Dr. Ambika Nair and entire team of Santigram Kerala Ayurveda Wellness Center, USA for creating an awareness on Ayurveda. Second thing I want to mention is our topic of the day, which is irritable bowel syndrome, known as IBS, which could lead to many other diseases, sickness like colitis, ulcerative colitis, Crohn's disease, and whatnot. We're finding out very interesting but very alarming facts from Dr. Ambika Nair, and I can assure you that these are for better health. So our urge and a request to all of you is that please, if you have any one of these symptoms, do not delay and go to your doctor soon as possible. In this third segment, we're going to know more on IBS and how Ayurveda can cure IBS. All right, doctor, coming back to this irritable bowel syndrome.
We'll talk about the causes. Okay.
Yes, please.
Okay, abhojana. Totally fasting for so many days.
आपने बताया.
Okay, that's not right.
Well, because we are religious and we believe
No,
अगर
no.
सोमवार शिव जी का
Okay,
है, गुरुवार गुरु जी का है,
that's
तो
not
fast
really.
करना.
1 or 2 days is okay. So many people do like so many days.
Yes.
It's very difficult
And
to
that's
make them
not good.
understand actually.
But then some people say the fasting is also good for your body.
Fasting is good, but not that everyday fasting.
That's
How
true.
it will work?
That's true.
Okay, so like abhojana, adhibhojana, too much eating is also not good. Okay.
Adha
Then
bhojana, ati bhojana.
Adhibhojana. Okay. Then ajirna bhojana, before digestion, you are eating too much.
Achha.
Okay, our digestion has to be taken care because we have to give little space for that also.
Ji.
Okay, so all these things are not at all good. Okay, so and then like vata, pitta, kapha, I told you. If it is like complications are endless and abundance. Okay, too many complications actually. Okay, for this IBS. First of all, their stress level is like that. These people end up in the emergency, so many times with the chest pain if they are with the pitta.
This lead to chest pain also?
Yeah, that's what I'm telling. Okay. So they always come like a headache ho rahe mere ko to chest pain ho rahe. This is an anxiety, understand? No? So they get a lot of fear. What will happen? Because they see themselves that how they are losing their weight, how much they are losing, and they have no energy to get up and go for the work.
Ji.
Okay, they cannot focus. Okay, so this all comes in a pitta. Kapha means their focus goes haywire. They are so irritated just for not only for the bowel, irritated for very small things. You see so many people like choti baat mein ladai rehte na, that they get so much mess up your life also.
Correct. Yes.
Even you are traveling somewhere, if you sit nearby them only itself, don't keep your hand like this, don't keep like that. Sometimes very interesting also.
Correct.
So these all like then they don't sleep in time. Sleep is one of the most important factor in this IBS.
Sleep and I guess not to worry too much. Not to have so much stress on your mind and the body.
Things will happen, but if you worry too much also nothing will happen.
It's not going to change anything.
Yeah, because
right?
actually this has to be taught to our people also, because unnecessarily worrying and spoiling your health just for nothing. Worry is important, and we cannot stop thinking. We are not telling you not to stop thinking. You should think, but think in such a way that it doesn't affect your health. That is more
especially
important.
stomach.
Yeah,
and it's this is what we call sensitive stomach. If you have
it becomes a very not only sensitive, it's like a horrible.
It's like
okay.
Now let's talk about cure.
Okay. So then vata also, see, according to the constitution. I told you IBS can be of any constitution. Then the treatment will be that because we had to see how their digestion, whether any blood is coming, whether only IBS is there. There are so many very good medicines also are there. Then first of all we give the Panchakarma. Panchakarma only the detoxification, because this fellow will, like a patient will be having all the toxins internally, mentally and physically. And internally, like whatever accumulation.
Ji.
So, like we give Shirodhara also to reduce the anxiety, that is a must.
Correct.
Okay. And we give them Abhyangam, so that body also, tan man, dono theek ho jayega. Then we give Basti treatment also. Basti is like a yoga Basti means according to the constitution of the person, we make different decoctions.
Is it a one-time therapy or?
How chronic it is, I have seen that with 3 or 4 weeks, they are
Achha.
really like 80% okay.
80% okay.
Okay. Then, like managing it, how to go. Then afterwards they will tell, now I go only 1 or 2 times, okay? You know, like they threaten me like that. And there are very good medications also that we give them. And their diet, we change it.
What can you tell our viewers to avoid what kind of food if they have IBS?
Only cooked food. When you have anything like that, because you always feel a bloated feeling in the stomach, you know, this is very important. That's you know, like not only acidity, some people will not feel any burning sensation. Only they feel that kuch bhi khao, we feel bloated. So that itself is, you know, like an IBS, you know, like a stomach is not good. At that time, you know, like they should not, you know, like overeat the things and eat only cooked food. Don't go for any raw food.
Okay.
You can use a lot of buttermilk. Buttermilk, every day you can take 1 or 2 or 3 times every day.
So regular milk is not good for IBS
because
patient.
it doesn't absorb.
Absolutely, I agree with you. Can they use alternative like soy milk, coconut milk?
Coconut milk can be used, but see in Ayurveda, because what we say that, you know, buttermilk is the best one.
Buttermilk is the best.
Best
no
one, and nowadays everybody come and ask me, can I use soy milk? You can use, there is no problem. Until if it is digested.
Correct.
Again I am telling, don't take it the wrong way. If anything digests, you can always have it. Yeah.
Anyway, so these are the IBS things. But if anyone comes to Santigram Kerala Ayurveda Wellness Center, USA with IBS, now we talked about treatments. Now the last part is medicine. How long they should be on medicine?
Some people need 3 months.
Gotcha.
Some people need 1 year.
Depends on
okay, because you know, like how then we taper all the medications. Liver has to be taken there, anxiety has to be taken care. You understand? No?
Correct.
Then internally, you know, so that you know that inactiveness has to be out from the small intestine.
So from mind to body.
Body, absolutely,
right?
yeah.
This is all in a balance.
Totally.
So that way you have a healthy stomach, and then IBS completely, it's a
completely
detox.
It can be cured. It can be cured completely.
And that's what Santigram Kerala Ayurveda Wellness Center USA is all about, to cure your sickness or disease. Dr. Nair, jaane se pehle, tip of the day, mantra.
Tip. If you are having anything like that, do first of all what you have to do is that drink buttermilk. I already told. And second one is that, you know, pomegranate ka jo chilka, the cover of that. Okay, you can just take like a small piece, just grind it properly and use with yogurt or with buttermilk.
Wow.
If you use it, sure you will be taken care of that time.
What about pomegranate juice?
Pomegranate juice is also good, but fresh juice.
Fresh juice.
But people, you know, don't, you know, like go for that. They will just buy from the shop, you know. There are so many other things.
You
know,
recommend fresh juice. It's up to viewers what they want to get.
And you know, like guava, you know, like amrutaka leaves.
Yes.
And a little bit of turmeric.
Correct.
You know, like if they grind it and they use like a paste, that is also very good for them. This is all very nice for them.
Very nice. Dr. Nair, thank you so much for letting us know about IBS, the cause of irritable bowel syndrome, and how Ayurveda can cure that. I am sure, I'm very positive that this will be very helpful to many of our viewers. So once again, thank you so very much, Doctor.
Thank you so much, Sanjeev ji.
Thank you. Namaskar.
Okay.
And,
have a good weekend.
Thank you. And this is the Ayurveda Mantra Show that you've been watching by Santigram Kerala Ayurveda Wellness Center, USA. Until we meet again at the same place and same time, we want you to be happy and healthy. So please do follow Ayurveda. And for more information, you can visit Santigram Kerala Ayurveda Wellness Center website, and you can contact us for any questions. info@santigramusa.com. I'm Sanjeev Pandya, wishing you all happy and a vibrant health ahead. So long.